Hi, I'm Murray, Head of Healthcare here at Huma and an NHS GP. And I'm going to talk to you about the global health tech business that is Huma and what we offer, particularly within the NHS, where we have a suite of tools that support millions of patients. We offer digital first care for patients, both in triage diagnostics, self-care, and also remote patient monitoring. We know that 1 in 3 patients end up in the wrong queue. And in an A&E setting, we can now digitally triage patients who arrive via an iPad and get the sickest patient right to the front of the queue really fast. But actually, our foundations are built within primary care, where we've conducted over 60 million consultations and we triage patients from home. So we have a great wealth of experience in this space. How it works? Patients come in either through the practice website or through the NHS app, and we gather a history from each and every patient and put that in front of the clinician. We can also remotely monitor patients, gathering information from wearables and proactively pushing it into the clinician. All this feeds into a clinician workspace where we present a summary of the history that's presented. We can read from and write to the patient's EHR, and we can also provide the clinician with all of the tools they need to respond to a patient, like messaging, video, or the ambient scribes in order to record a consultation. And we take it a step further at a neighborhood level, using advanced artificial intelligence, which we call Huma intelligence, to route patients to the right clinician first time. In an A&E, we gather a history from the patient through an iPad, and we can identify the sickest patients really early on in that journey. We eliminate the queue, and everyone is triaged within 5 minutes of arrival. Our goal is to move cases around the system and not patients. So patients, wherever they flow into the system, can be routed to the right and most appropriate place, whether that's a dermatologist for a skin lesion or straight into emergency care for a case of suspected meningitis. Lastly, I'm going to show you our remote patient monitoring capability. We can build you Class 2B MHRA approved applications within minutes. And this is in use currently across 60 trusts to monitor gestational diabetes within the NHS. So welcome to our Huma intelligence-driven application builder. And I drop a prompt in saying I'd like to monitor people with high blood pressure in Scotland and hit the generate button, at which point it pulls from the thousands and thousands of apps that we've built over the years and is going to create us a template application for us to work on. And now our application is ready. I'll hit this button here and open the editor. And here you can see it's created us a template application with various data it's pulling in. It's given us a medication screen, vital screen. We can add more to it here. So we could add in, say, some different air vitals. We might want to monitor air quality, for example. It also has created content for us. So actually content that you can push to patients about understanding hypertension, its impact on health. It's created that content for us. And we can link devices. So we can link Apple devices, Google Fit devices, Fitbits, or blood pressure monitors, blood glucose monitors, etc. And then to publish this application, we've got a QR code that we can just hit, and then you could push that to patients. And here is our clinician-facing dashboard, where you have a list of patients that are all being monitored through those applications, and then flagged according to whatever readings come through. So we might need to delve into one of those patients because we're worried about some red flags against their name, and you can then delve into their data and have a really close look at, say, their pulse, their blood pressure over time, and allows you then to contact that patient and send them a message, call them, etc., and basically monitor them remotely. Thank you very much, and if you'd like any more information, please get in touch.